This video is on Chapter 6, the skeletal system. Remember that the skeletal system is an organ system. Let's look at the components of the skeletal system, and of course bones is one component. There are about 206 bones in the body, also called osseous tissue. And remember that bone is composed of osteocytes that are in lacuna surrounded by a very hard matrix. Now another component of the skeletal system is joints. Joints are where two or more bones connect. And we'll be talking more about joints in Chapter 9. Another component is cartilage. And we've talked about cartilage, or you've seen hyaline cartilage in the tissues chapter. And lastly, we have ligaments. Remember that ligaments connect bone to bone. If you look at all of these structures that make up the skeletal system, which of the four major tissue groups do they belong to? Well, if you said connective tissue, you would be right. They are all part of connective tissue. We're going to talk about bones in a lot of detail in this chapter. Joints are the next chapter. We already know about ligaments, but let's focus a little bit on cartilage. There are three types of cartilage in the skeletal system: hyaline cartilage, elastic cartilage, and fibrocartilage. Hyaline cartilage you've already seen, so you've had to identify it under the microscope, and we've talked a little bit about it in Chapter 4. It is the most abundant type of cartilage, and remember that you've got chondrocytes in lacuna. So in this picture here, you can see the chondrocytes, and you can see the nuclei in the middle stained a darker pink, and they've kind of pulled away from the cavity. Now the reason for that is that when they prepare this tissue, they add chemicals that basically cause these cells to shrivel up. So in a normal healthy tissue, the chondrocyte would fill out the entire lacuna. If you look in the matrix, it looks kind of opaque. So you can kind of see light getting through it, but you can't see anything. However, there is collagen in this matrix. You just can't see it. Most of the fetal skeleton is made of hyaline cartilage. At about 8 weeks, the fetus has an entire skeleton, but that skeleton is made of hyaline cartilage. As the fetus develops, the cartilage is slowly replaced with osseous tissue or bone until the only places that you find cartilage left are in areas where you need some flexibility. If we take a look at this picture here, you'll see that they have color-coded the three types of cartilage. But let's take a look first here at this designation. So they've divided the skeleton into axial and appendicular. Now remember, the axial skeleton are all the bones of the head, neck, and trunk. In this picture, they are shown in a dark tan color. Appendicular skeleton are all the bones of the limbs, and they're shown in this lighter tan. Let's look at hyaline cartilage, because we just talked about that. And so it's shown in blue, and you'll notice, first of all, here it is in the nose. When it's found in the nose, they call it nasal cartilage. It is still hyaline cartilage. It's just the nasal cartilage term tells you it's the hyaline cartilage in the bone. Then in the nose, I'm sorry. Then you'll also see that really wherever bones connect here, you've got hyaline cartilage. In that case, they call it articular cartilage. Now it is still hyaline cartilage, but articulate means to connect. So wherever bones connect, the cartilage you find, they're going to call it articular cartilage. A couple other places you'll notice here where the ribs connect to the sternum, you've got it also. Now here they'll call it costal cartilage. It is still hyaline cartilage, but again, the term directs you to where the hyaline cartilage is found in the body. Now if we look over here, you'll see some more blue. And this is found in structures such as the larynx, the trachea. Where the trachea splits is called the primary bronchi. This is all part of your respiratory system. So this is named respiratory cartilage. And again, it is still hyaline cartilage. So again, hyaline cartilage is the most abundant type found in the body. But what about elastic cartilage? Well, in elastic cartilage, you will see it is similar to hyaline cartilage. It has chondrocytes in lacuna, and yes, the chondrocytes are kind of closer together. The chondrocytes are surrounded by this matrix, and you'll notice that these purple fibers, which are elastin fibers. So this allows the tissue to bend, but then snap back to its original shape. And if we go back for a minute to this last slide, you'll notice that elastic cartilage is shown in green, and we can see it here in the ear, and then here over here is part of what's called the epiglottis. Now the epiglottis is this, it looks like a little mini tongue here, and its role is to prevent food from getting into the trachea and into your respiratory system. You wouldn't want that to happen. So just to show you this in the next slide here, if we look over to the right, you can see the trachea, and behind it is the esophagus. So this would be anterior towards the front of your body. This is posterior towards the back. And the esophagus is going to continue up into what's known as the pharynx or the throat. And so what happens here is this is where you're going to see this epiglottis that kind of comes up like this tongue-like structure. This is the epiglottis here. And remember, this is what's made of the elastic tissue. So imagine that, this is your throat up here. So as food comes down, what happens is that the epiglottis is going to come down and cover the entrance to the trachea. So the food can't get in there, it's kind of forced down into the epiglottis. However, when you're breathing air, the epiglottis snaps back up, so the air can go down the trachea. What allows it to bend and snap back is elastic cartilage. The last type of cartilage is called fibrocartilage, and again, this is similar to hyaline cartilage. You've got chondrocytes, and here they're really shriveled up into little pink dots in lacuna, right? A little bit harder to see because in the matrix is really heavily filled with collagen fibers. So these blue strands here, blue-purple, are actually collagen fibers. Now remember, collagen conveys strength. So this type of tissue has great tensile strength. And tensile means you can pull it in the direction the fibers are going and it will resist being torn apart. So these fibers are kind of going in this direction. So you could pull it in either way and it's going to resist separation. Fibrocartilage also, believe it or not, has a lot of water in it, so it's a very good shock absorber. It's highly compressible. So if we go back to the picture that we saw here, you'll notice fibrocartilage is shown in red, and we can see it here in the knees. Okay, so this would be, it's called the meniscus. And we can also see it right here. This is called the pubic symphysis. And lastly, this is a little hard to see, but right here, where it's called the intervertebral disc. That's an R, vertebral disc. And just to look at this a little more closely, if you look here, you'll see the red fibrocartilage, and around it on either side is hyaline cartilage. And that's true here. Also, red in the middle, fibrocartilage in the middle, surrounded by hyaline cartilage. And it's also true here. So this is usually what you'll see when you see fibrocartilage. You'll see fibrocartilage will be in the middle, okay, like that. And then on either side of it, you'll see hyaline cartilage. So you got hyaline on the outside, and you have fibrocartilage on the inside. And we'll see this later on when we look at joints. But this allows for resistance, strength, great strength, and also a good shock absorber, because at this joint, the whole weight of your body is pushing down here. And likewise, that's true here and for the intervertebral discs. Okay, so what is the function of bone? Well, the first function is to support. Bone forms this internal framework that supports the soft tissues. Another function is protection. For example, your skull protects your brain. Your ribs protect your heart. Also, movement. Skeletal muscles are attached to bone by tendons, and the skeletal muscles use the bones as levers to move. So we could say that bone is involved in movement, although it's really the major role of the skeletal muscles. And then storage. Believe it or not, bone stores minerals such as calcium, phosphorus, manganese, zinc. When your body needs it, those minerals are released to the blood to travel to wherever it's needed. And lastly, all blood cells form in the cavities of bone, so blood cell formation. Now, there are many types of bones in your body. So for scientists to make sense of them, they put them in these categories based on their shape. And there are 4 categories: long, short, flat, and irregular. When you do the axial bone lab, you're going to start to see this as you look through the various bones. But let's start with long bones. Long bones are longer than they are wide. And you can see that here with the femur. The femur is the biggest bone in the body. It is the bone in your upper leg or your thigh. So longer than it is wide, and it kind of flares out at the ends here. Here's another example. This is your hand, and these last 3 sets of bones, 1, 2, 3 here, these are called phalanges. These are the bones in your finger. So you can see they are longer than they are wide. Even this little tiny one is longer than it is wide. So long bones aren't always super long like this, but they are longer than they are wide. So keep that in mind, and that will help you identify them. Another type of bone is called short bones, and these are more cube-shaped. I think they look kind of like pebbles. You can find them in the wrist. So they're called the carpals, the bones of the wrist, and you can see they do kind of look like pebbles. Or in the bones of the ankle. So these are all short bones. Even this big one here, it has a special name, the calcaneus, the heel bone. So these are some of the places you can find short bones. And then we have flat bones. Flat bones are flat, curved, and thin. And here's an example. This is a rib. Also the bones of the cranium, which is the top of your skull, they are also flat bones. Lastly, we have irregular bones. Irregular bones are irregularly shaped, and I will say that this is actually a no-no. So when someone asks you to define a word, don't use the word to define itself. In this case, I'm going to do that, but I'm going to go ahead and explain it even further. Irregularly shaped bones don't fit into any other category. So for example, this is a vertebrae. These are the bones in your back. And they're not short, they're not long, they're not flat. And so the only other category is irregular. Here's another one, the coxal bone, also known as the hip bone. This is half a hip bone. But you'll notice, you might say, well, wait a sec, this part looks like a flat bone. And you would be right, this part is a flat bone. In fact, during development of the skeletal system, the coxal bone is broken into 3 separate bones that all fuse together at some point in growth. And this bone here is called the ilium. And if the ilium was by itself, yes, it would be a flat bone. But once it fuses to the other and forms one coxal bone, it is no longer a flat bone because only this part is flat. The rest of the part is, I don't know what. So that's why it goes in the irregular category. Bone also can take different structures, and there's two major structures you'll see. One is compact and the other is spongy. So compact bone basically forms a dense outer layer of all bone. So all bone on the outside, whether it's short, long, flat, or irregular, has compact bone on the outside. Compact bone looks smooth, and you can see that here, smooth. It is homogeneous, which means the same throughout. And you will find it making up the shaft part of long bone. Spongy bone, on the other hand, is made of slivers of bone called trabeculae, which have lots of tiny open spaces. So if we look over here, you'll see spongy bone. And I don't know if we can see a little closer, but you can see that it looks like there's this crosswork of bone with pores in the middle. So it's kind of like a sponge. If you think of a pink sponge, then the pink part would be the trabeculae. They would be the slivers of bone, and the openings are the pores. Now these pores are not empty. So in the spaces are either red or yellow marrow. Now that we've looked at some of the basics, let's take a look at the gross anatomy of long bone. So this is a long bone. It's longer than it is wide, and this particular bone is supposed to be the humerus. The long part now of the bone is actually called the diaphysis. Okay, so that's a Greek word, diaphysis, and the ends of the bone where it flares out, those are called the epiphysis. Epiphysis. So if I told you that this part right here connects to the trunk, this is your upper arm bone, by the way, would this be the proximal or the distal epiphysis? Well, if you guessed proximal, you're correct. Remember, proximal is a directional term that means close to where the limb attaches to the trunk, and that makes this one the distal epiphysis. Some other structures, you'll notice there's a blue coating on the top and there's a blue on the bottom. That is articular cartilage. Remember, this is hyaline cartilage that covers the outside of bones where they connect. Now, covering the outside of the hyaline cartilage is something called perichondrium. Perichondrium is a connective tissue which protects the cartilage and prevents it from expanding too much outward. It also contains blood vessels. So remember, cartilage is avascular, and the perichondrium brings nutrients and oxygen to the articular cartilage through its own blood vessels. Then if we look down here, we'll see this line here, and if we could see down here, we'd see the same line. This is called the epiphyseal line. And this is where, some people call this the growth plate. This is where growth ended during development. Now this part, the diaphysis, is made up of compact bone. So this bone is actually compact bone here. And the compact bone also has a protective layer of connective tissue, but this is called periosteum. Now in the middle of the diaphysis is a cavity, and this is called the medullary cavity. Medulla means the inside of an organ, inside. So medullary cavity, and this cavity is lined with connective tissue called endosteum. Now this endosteum actually contains bone-forming cells, which you know as osteoblasts. In the medullary cavity, you can see it's not empty. So what we're going to do next is take a closer look at this part of long bone. Now this next slide are just basically notes on some of the structures I mentioned in the last slide, so I'm going to move on. And here we can see a chunk of the diaphysis. Now again, the outside here, right here, is the connective tissue called periosteum. And remember, this is protecting the bone. You can see going through the periosteum are blood vessels. And remember that bone is very well vascularized, so lots of blood vessels. And then we have these kind of fibers here. So based on the structure, what do you think the function of these fibers are? Well, if you said they're glue, they're like glue, they're connecting the periosteum to the bone, you would be correct. These are called Sharpie's fibers. Okay, so that's an S, Sharpies, named after the person who discovered them, and they're made of collagen. So they're very strong. If we look here to the inside, you'll see the little tree trunks, which is what you saw under the microscope. So this is actually what makes up compact bone. And in this particular medullary cavity, we see this yellow marrow. And yellow marrow is pretty much fat. And so here's one of the storage functions of bone. It stores fat. And this is what you would find in adults. In infants, you would find what's called red marrow in the medullary cavity of long bone, red marrow. And we'll talk about that in a minute. Now, lining the medullary cavity, of course, we said was endosteum. So we'll write that down again. Remember, this is a connective tissue with bone-forming cells. Okay, so what about that red marrow? Well, we said red marrow in infants is found in the medullary cavity of long bone, but it's also found in spongy bone, in the spaces, the pores. Red marrow is where blood cell synthesis is occurring. In adults, red marrow is found in the pores in spongy bone, in the heads of the femur and the humerus. So think of the big bones in your body, the femur, which is the thigh bone, the humerus, the upper arm bone. In the epiphysis of those bones is spongy bone, and that's where you find a lot of red marrow. It's also found in the pores in flat bone. So if you wanted to, for example, perform a bone marrow transplant, you wanted to take a portion of somebody's bone marrow and give it to somebody else, perhaps who had cancer of the bone marrow, you want to go to a place where there's a lot of bone marrow or red marrow. In an adult, the most active sites are in the hip bone, which is an irregular bone, so in the spongy part of the hip bone, or in the sternum, which is a flat bone. However, you probably wouldn't go in the sternum, because when you need to take bone marrow, the needle not only goes through the skin and the muscle, but it has to go through the bone. And so you have to exert a fair amount of pressure, and you certainly wouldn't want to make a mistake and go and hit the heart, which is right under the sternum. So most of the time, they're taking the red marrow from the hip bone. Okay, so now that we have looked at the gross anatomy of long bone, let's take a look at the microscopic anatomy. This is a bone. This is supposed to be the humerus, I believe. And here we're going to take a little chunk right here. So here's that chunk. And now this is compact bone, right? Compact bone. And you'll see on the outside, again, the periosteum. See the periosteum on the outside. And then you also see the Sharpie's fibers, right, that are holding the periosteum, kind of binding it to the bone. You can see the blood vessels again. And everything in here is basically compact bone. Everything is compact bone. So when we look at compact bone under the microscope, well, we notice it's made of these tree trunks and repeating units of these tree trunks. So now we're going to give them a name. They're not tree trunks. We're going to call them osteomes. And osteomes are really important because they are the building blocks of compact bone. And there is a term for this. It's called the structural unit of bone. So the structural unit is actually repeating units of the structure make up an organ. Okay, so a structural unit, we're going to find this in many different organ systems, is the unit which makes up the organ itself. Think of it as the smallest building block. So when you think about proteins, for example, they're made of repeating, well, not repeating units, but they're made of amino acids. Those are the building blocks. And so in bone, the structural unit is the osteome. But the osteome is also the functional unit. The functional unit can be defined as the smallest structure that carries out the role of that organ. So the smallest structure that carries out the role of that organ. Okay, so if you think about the overall role of bone, we had different functions, but the overall role is it's a weight-bearing unit. Okay, so we can say that the osteome is the structural and the functional unit of bone. So if we go back to this figure again, you'll see, well, compact bone is made of these repeating units of osteome. But now let's look at the osteome a little closer, and we're going to take a little chunk, like a piece of the pie here, and magnify it. And you'll notice that going through the center of every osteome is a canal. And this is called the central canal because it goes through the center, or it's also named the Herversian canal after Dr. Herversian, who discovered it. Remember that when a structure is named after the person who discovered it, it's called an eponym. And this is an eponym. This is something that is kind of being phased out in common medicine now. Instead of using eponyms, they're trying to use a name that actually describes the structure. So we've got the central canal, and then you can see the osteocytes here sitting in the lacuna. And then surrounding these osteocytes are lamella. Now lamella are concentric rings. They're the tree rings here, and they're made of the matrix. And the matrix is hard. One of the things that happens when this tissue is forming is that instead of osteocytes, these are osteoblasts. And the osteoblasts are all stretched out, kind of like they have many arms that are stretched out. They are making the matrix and excreting it around themselves. When the matrix starts to harden, the osteoblasts start to pull inward. But they leave behind these little cracks here where they used to be. And those little cracks remain, and they are called canaliculi. Now, canaliculus is singular, meaning one. Canaliculi is plural, meaning many. So this lamella, this hard matrix, does not let anything through, including oxygen and nutrients. But these cells need to get the oxygen and nutrients coming up through the central canal in the blood vessel. So up comes the nutrients and oxygen here, but how does it get out to this further cell? And likewise, these cells are making waste and excreting CO2, and that needs to get dumped back in so the veins can take it away. Well, the way it gets through is through these canaliculi. So imagine we've got nutrients. They're going to travel from here through this canaliculus, through this one, and that's how they get out to this one. And likewise, the waste products go back that way. So that's the importance of them. Now, one more thing I want to mention is when you look at compact bone, you'll see it's made of repeating units of osteone. But going around the outer edge here, you'll see lamella that are not part of any osteone. In fact, they go around the circumference, meaning the outside of the bone. So these are called circumferential lamella. Okay, so we talked about the osteon. Here's just another figure showing you again the central canal, and you can see now there's arteries, veins, and even nerves running through here. We have the lacuna, we have the osteocytes that completely fill up the lacuna. We have the canaliculi, and then the lamella. Now I did want to mention something about an osteone. So here we have an osteone, repeating these the lamella, but they've kind of pulled it apart. And they've done it so that you can see something about the lamella. So lamella is the hard matrix, right? And it has in it water, ground substance, but it also has lots and lots of collagen. And remember that collagen provides strength. It reinforces the bone. So you'll notice that in this particular lamella, the fibers are all running this way. See that? They're all running in the same direction. And then in the next lamella deep to that, they're going this way. And then in the lamella under that, they're going this way. So what you end up with one osteone are collagen fibers that are going in opposite directions. And what that does is that helps to reinforce the bone and allow it to be flexible without breaking. So keep in mind that the direction that the fibers are going, like in this particular one, they're going this direction, that means you can pull it that way. You could pull the bone in that direction, or you could pull it in this direction, and it wouldn't resist, it wouldn't tear. But it's also going in this direction. See that? So you, oops. See if I can make this better. Skip that one. It's also going in this direction. And it's going in this direction. So you can pull it that way. In fact, you can pull it in many directions. So when collagen fibers overlap like this, what it does is it reinforces the bone and allows it to be flexible. Okay, so that doesn't mean your bone is going to bend, kind of like those noodles that you use in pools. It's not going to bend like that, but it does bend a little tiny bit. And that flexibility is important, and it's because of this overlapping collagen fibers. Okay. So now let's take a look at the gross anatomy of spongy bone, because we've been looking at the gross anatomy and the microscopic anatomy of flat bone. Spongy bone, when you look at spongy bone, what you have is you have a thin layer of compact bone on the outside and the inside. So we could say you've got a thin layer of compact bone on the outside and you've got spongy on the inside. Okay, so if we take a look at this picture here, first of all, you'll see this blue layer, and that, of course, is articular cartilage. And articular cartilage, remember, that's hyaline cartilage. And then here's that thin layer of compact bone, which you find on the outside of all spongy bone. And then on the inside, you have these little slivers of bone, and they call these trabeculae. Now, trabeculae, you can see there's pores here. Trabeculae are covered with endosteum, which is the connective tissue. And in these spaces here are where you find bone marrow. Okay, so I should probably color that red there. But bone marrow is found in the pores of spongy bone. Okay, so let's take a look. This is, we're going to take a piece of flat bone from the skull. You can see compact on the outside, spongy on the inside. And if we look at that even closer, you can see here are the trabeculae. Now this, of course, is not from a living organism, so you don't see the red marrow, right? There should be red marrow in here. There would be. But a couple of things here is that in spongy bone, you do have lamella. They're just not running in a circle. You also have lacuna with osteocytes in them, and you have canaliculi. So again, in spongy bone, you have trabeculae, which are the slivers of bone, but you also have lamella, osteocytes, canaliculi, and lacuna. The only thing you don't have in spongy bone that you have in compact bone is what? You think of it? Well, osteum. So spongy bone doesn't have the formation of the osteum, but otherwise it's pretty much the same. What about the components? So bony bone doesn't have the formation of the osteum, but otherwise it's pretty So now that we've talked about bones, what about the components? So bones are made of an organic and an inorganic component. Organic just means it contains a carbon. And living things are made of organic compounds. So these are a couple of the organic structures. First we have osteoblasts, which you already know about. These are bone-forming cells. Then we have the osteocytes, which are mature bone cells. There is another type of cell called an osteoclast, and these are cells which break down bone. Okay, these break down bone, and we're going to talk about these later. Now lastly, you have osteoid. Osteoid is actually the organic part of the matrix. The organic part of the matrix. Remember, the matrix is made of ground substance and collagen fibers. The osteoid gives bone its flexibility. That means, you know, it allows a little bit of bending. It allows the bone to resist breaking when it's twisted. Okay, that is called the osteoid. So those are the organic components. What about the inorganic, meaning not containing carbon? Well, actually, inorganic components include calcium, phosphate, but there's also potassium in there. There's sodium, magnesium. There's lots of different minerals. But I'm just going to focus on calcium here for a minute, because calcium is an incredibly important compound in your body. And the form of it is ionic. Ionic means it has a charge. And so a calcium ion is written like this. Ca++ means it has a +2 charge on it. So what is calcium needed for in the body? Well, you already know you need it to make bone. So I'll say development of bone. But you also need it for muscles to contract. And you're going to find this out in a later chapter. Muscles will not contract without calcium, and this includes the heart, which is a muscle made mostly of cardiac muscle. You need it in order for blood to clot. Blood will not clot without calcium. You need it for glands to secrete. In addition, no nerve impulse without calcium. So you need it for a nerve impulse. And lastly, mitosis. Mitosis will not occur without calcium. So calcium is really important in our bodies. We're not going to be alive if we don't have calcium. If this is the case, then we need to store calcium. We want to always have an available supply. And so 99%, let me fix that for a minute there. 99% of all the calcium in your body is stored in bone. So at any one time, that's where you're going to find it. Most of the rest of it can be found in cells, in the cells that need it. For example, muscle cells, or in glands, or in bone. But a very, very small amount is found in your blood. And It is a range. It ranges from 9 to 11 milligrams per 100 milliliters of blood. Okay, so 9 to 11 milligrams of calcium. Okay, so again, most of the calcium in your body at any one time is in your bone. A tiny, tiny amount is in your blood. So how is calcium controlled? Like, what determines when causing it to move from your blood to your bone? For example, if you just drank a lot of milk and now you have high levels of calcium in your blood, what causes it to be stored or deposited in bone? Likewise, if you're going through a big growth spurt, what causes it to be released from bone to the blood? Well, hormones do. So I'm going to show you this with this little diagram, and in this diagram it's a seesaw, and so when it's balanced it means you are in homeostasis, and the particular parameter we're looking at here is the blood level of calcium. So the normal homeostatic range of calcium in your blood is 9 to 11 milligrams of calcium per 100 mils of blood. So if you're in the range, you're in homeostasis and the seesaw is balanced. But let's say you're like a lot of Americans, especially female Americans, where you don't have enough calcium. So now you're out of balance. Maybe you've got 5 milligrams per 100 ml of blood. So the calcium levels are falling. They're too low. Well, when they're that low, as the blood passes through the parathyroid glands, and here you will see these 4 little knob-like areas are the parathyroid glands. These are on the posterior part of the thyroid gland, which is a much bigger gland. It's found in your neck area. So when blood passes by the parathyroid glands, if the levels of calcium are too low, the parathyroid gland releases parathyroid hormone, and it travels through your blood all the way to your bone. When it gets to your bone, it activates these osteoclasts. Remember, these are the bone breaking down cells, and they chomp on the matrix of bone and release calcium. That calcium goes into your blood, and now the blood calcium levels go up. So you're back in homeostasis. What kind of a feedback mechanism is this? So in the beginning, blood calcium levels are going down, down, down. But then at the end, they're going up, up, up. So if you said negative feedback, you would be correct. Okay, so this is one way, this is the way in which calcium levels are controlled. Now, on the other hand, how is it deposited from your blood to your bone? So we know that parathyroid hormone causes it to be released from the bone to the blood. But how about the opposite? Well, to a lesser extent, it involves calcitonin, which is another hormone. Now, calcitonin is made in the thyroid glands. So if the blood levels of calcium are high because you just drank a gallon of milk, then as the blood passes by the thyroid gland, it releases calcitonin. And calcitonin causes calcium to be deposited in bone. So it goes from the blood to the bone, and then the blood calcium levels go down. What kind of a feedback mechanism is this? So in the beginning, the blood calcium levels are going up, 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 and at the end of this, they're going down. Well, if you said negative feedback, you would be correct. Remember, negative feedback prevents change in the same direction. But I do just want to put a little caveat here in that this is an overly simplistic explanation of how calcium gets deposited in bone. So this is a small component. Calcitonin plays a very small role. It is a lot more complex than that, and I will leave it at that. So calcium is so important for all these major functions in the body that you need to survive. How much calcium do we need to take in every day? Well, right now, from birth to 10 years, it is recommended that people take about 400 to 800 milligrams of calcium per day. And this is recommended by the National Osteoporosis Foundation. From the ages of 11 to 24, it jumps 12 to 1,500 milligrams per day because people are growing and you need a lot of calcium. Greater than 24 years of age, 1,000 to 1,200, 1,000 to 1,200 milligrams per day. And then in postmenopausal women after they've gone through menopause, greater than 1,500 milligrams per day. And that has to do with bone loss and the loss of calcium. And we'll talk about that a little bit later.
you.